This is a novel coronavirus update and alert, and it's something I think that is very important for y'all to be aware of and its implications. What I want to do is share this article from Vox, why it's so important, and the reference study that was published by the Lancet medical journal. And if you're not familiar with the Lancet, it is a most prestigious and respected international medical journal. The study that was published and referenced in this article proves patient 0 had no contact with the Wuhan Seafood Market. The second revelation is the study shows human-to-human transmission from the beginning of the virus outbreak. Then it also reveals that the first confirmed case was much earlier than reported by the Chinese government, our governments, or the mainstream media, and as well as me, which reported it as being December the 12th, which once we look at this report in the article, we'll understand it was sooner than that. So let's go through the article published by Vox on January the 27th, just 3 days ago. Now understand this article and the reference study published by the Lancet was not shared by the US government or any other government or the CDC, as well as any other mainstream outlets, which are still reporting that it is not confirmed that human-to-human transmission is possible. This is due to the fact that in the US, we have had 5 confirmed cases of the virus and no other cases, supposedly, at this time. All 5 cases in the US are people that traveled to Wuhan, China, and returned to the US. So what our government is saying, and our mainstream media outlets is, and the CDC, because I'm tracking them as well, is saying there is not proof as of yet that there is human-to-human transmission. But what you're going to see when we go through this article, as well as what they share and they reference from the Lancet's published study, that yes, indeed, there is human-to-human transmission, and there was from the very first part of this novel coronavirus. So here's the article, and it's titled, "Did China Downplay the Coronavirus Outbreak Early On?" A new study shows the virus took off weeks earlier than Chinese officials had suggested. In late December, when the Chinese first announced the outbreak of a mysterious pneumonia, officials in the country were quite clear of a few things. Most of the patients had been exposed to a food market in Wuhan, the city that's still the epicenter of the outbreak according to local health authorities. The earliest case had symptoms just 2 weeks earlier on December the 12th. There was also no clear evidence of human-to-human transmission, meaning the virus wasn't yet spreading from one person to another. That suggested people might have been getting sick directly from animals in the market. Together, the details, while concerning, were somewhat reassuring for global health experts. They suggested that this outbreak of the deadly new coronavirus began very recently and might not spread very far, and that the general population was not at risk of a serious illness. And that all being said, that is what is still being reported to all of us by our government, by the CDC, and by mainstream media. And what you're about to see, that is just not the case. Since last week, the case toll has exploded. Now we're currently at over 8,171 deaths. So like I said, the information contained here is old. What is important is here. The new study published on January the 24th in the Lancet helps explain why the authors, Chinese researchers, and doctors working in Wuhan paint a very different portrait of the first days of the outbreak. They suggest the virus and its spread among humans took off weeks earlier than Chinese officials said. The researchers reviewed the clinical charts, nursing records, lab findings, and chest x-rays of the first 41 patients. Now, these were the first 41 patients confirmed with the 2019 nCoV coronavirus. Among other things, they reported that the first case of the 2019 nCoV wasn't even linked to the Hunan wholesale seafood market at the center of the outbreak. Now, think about that. Our government, as well as all governments, as well as all mainstream media outlets, keep saying and referring to the fact that this outbreak occurred at the Hunan Seafood Market, where this study by the Lancet journal shows it did not. And the patient zero, the first person confirmed with the virus, had no connection to the Hunan Seafood Market. These discrepancies add new urgency to the question many are already asking. Did China downplay the outbreak early on? And if so, why? A new view on the early corona cases. There are a few key differences between China's earlier reports to this outbreak and the findings in the new Lancet study focused on the first 41 patients. These are the most concerning. The first one being, more than a third of the earliest cases had no connection with the market. Think about that. A third of the earliest cases had no connection with the Hunan Seafood Market. And down here they have charts to represent this. As you can see from the Lancet chart, by the time China alerted the world about the outbreak on December the 31st, there were already numerous cases detected with no connection to the Hunan market. Now I want you to look at this chart and digest it. Now you know I reported, as well as all governments and mainstream media has reported, as well as our CDC here in the US, that the first case was on December the 12th. If you look at this chart that the Lancet study has published, the first case was on December the 1st, 2019. And you'll see two different colors here. One's light blue and one's light red. If you look up above, it says Hunan Seafood Market exposure. The light blue is no. In other words, the patient had no exposure to the Hunan Seafood Market. The light red is yes, they did have. And here, right here, on December the 1st, 2019, the very first patient confirmed, and these were confirmed by laboratory test results, had absolutely no exposure to the Hunan Seafood Market. Then, on December the 10th, there were 3 more cases, 2 of which also had no connection to the Hunan Seafood Market, while third case did have a connection. Then from December the 10th to December the 14th, there were no more new cases reported. Now, on December the 15th, on December the 14th, there were 2 more cases reported that did have connection to the market, as well as there was 1 case on the 17th, the 18th, and 19th, as well as another 5 cases that were all connected to the Hunan Seafood Market. Then there were another 2 cases and another 2 cases, 2 of which had no connection to the market, 2 that had connection to. And you can see, based on the colors, there were people that had absolutely no connection to the Hunan Seafood Market, as well as those that did. And remember, this was only reported, it says right here, epidemiological alert. This is when China, right here, told the world. That was December the 31st, 2019. The Hunan Seafood Market was then closed on January the 1st, 2020. But on that same day, there was also another person that had absolutely no connection with the Wuhan Seafood Market. Although, as of January the 2nd, 2 days after China's first report on the outbreak, 27 of the 41 patients had been exposed to the seafood market, meaning more than a third of the patients hadn't. But yet, here we are, January the 30th. Our governments, our mainstream media outlets are still saying that it emanated from the Wuhan Seafood Market. As well here in the US, our CDC and government officials are still saying there is no confirmation and no evidence yet as the virus being transmittable from human to human contact. The graph I just showed you and the study published in the Lancet paints a different story. It paints the fact that yes, indeed, it is transmissible from human to human, and it has been since the very onset of the novel coronavirus outbreak. Now we're going to discuss the outbreak's first or indexed case. Also had no connection to the market, and that's what the chart above shows you on December the 1st, 2019. We refer to this patient, and you'll see it many times in pandemic movies from Hollywood, as patient 0. And as I've said, this patient 0, that was confirmed to be infected with the novel coronavirus on December the 1st, had no connection to the seafood market. And here it's stated in the box article. Even more intriguing, the first known patient, represented in the blue bar on the left in this graph, also had no market exposure. And that person became ill on December the 1st, nearly 2 weeks earlier than the Wuhan health authorities had suggested about the first case. The study also reports no epidemiological link was found between the first patient and later cases. So not only did a sizable portion of the early cases have no market link, the first known patient didn't either, and no one knows how that person became infected. So if you watch my videos and been subscribed to the channel for any length of time, even if you have over the last couple of weeks, you'll know I did a video about my thoughts and my thinking on where this virus emanated from, which is, and it's such a great coincidence, I just couldn't believe it, the only P4 lab that conducts research and studies on infectious diseases and viruses just so happens to be located in, of all places, Wuhan, China, the epicenter of this brand new, never before seen novel coronavirus. And that's pretty outstanding. And it could be a coincidence. But along with the facts presented in this study, and the fact that the first patient, patient 0, had no link to the market, it makes you wonder, where did this virus originate from, and was it leaked from that P4 lab in Wuhan, China? This indicates the spread of the virus in Wuhan was likely happening months sooner, as early as October. Daniel Lucy, an infectious disease physician and adjunct professor of infectious diseases of Georgetown University Medical Center, told Vox. It also indicates that there were have been multiple places in the food supply chain where people were exposed to animals with the virus, he added. There's two possibilities. If they did not get infected at the market, they got infected from an animal that had the virus in a different market or place where the infected animal, or any place where there was an infected animal. Second, they got infected from another person. So there was already person-to-person spread. The third point, there was direct evidence of human-to-human spread as early as January the 2nd. Relatedly, according to the Lancet paper, the first person who died from the virus on January the 9th and had exposure to the market passed it along to his wife. Even though she didn't have any history of market exposure, this was an early sign that human transmission was at least possible. It's also possible the wife handled infected meat her husband brought home from the market, for example. And that's a possibility. By January the 10th, though, another family with the virus was identified according to a second Lancet study, also published on January the 24th, and focused entirely on one family in Shenzhen. 5 members had recently visited Wuhan and had the virus, as well as another relative who never traveled to Wuhan. Notably, none of these individuals visited the Hunan market. And there you go. No one in this family visited the Wuhan Seafood Market. They did visit Wuhan, and they did contract the novel coronavirus. These two examples of potential human-to-human spread surfaced nearly 2 weeks before China confirmed the first cases of human-to-human transmission on January the 20th. With all that said, here still in the United States, our own CDC and our own government is still saying, regardless of what China is saying, regardless of what these studies were published in the Lancet, one of the most prestigious and respected medical journals in the international community, they still are saying they cannot confirm there's human-to-human transmission at this time. You got to wonder why they are keeping that up. Because I don't know about you, but this article and the study, which I will also provide in the description below the video, proves beyond a shadow of a doubt that there was human-to-human transmission from the very beginning stages of the viral outbreak. The fourth point they bring up here is more than half of the early cases were people under the age of 64, and half in the ICU were between ages 25 and 49. Now, just as today I was watching mainstream media outlets that were still saying, even though this is bad, it only seems to be affecting the majority of the people are elderly and have underlying health conditions. Well, as you will see if you read the Lancet published study, that's not the case. The actual data shows only 32% of the first 41 patients, and they have a second study for the next 99 patients that they've also published here, I think today, shows that it wasn't the majority of people being elderly or with secondary medical complications. No, actually, in all truth, it was an age group between the ages of 25 and 49, which is what we're about to look at now, that have in the majority of contracting the novel coronavirus. And that's what we're going to look at now, as the article says. But if you look at this age distribution of patients in the Lancet paper, this tells a different story. The majority of patients being admitted to the hospital, even to the intensive care unit, were age 64 and under. Roughly half of those admitted to ICU were ages 25 to 49. What's more, only 1/3 of these patients had underlying illnesses. And if you look at their chart here, you can see the majority of cases in the first 41 cases reported were age 25 to 49 years of age. And the majority of this age group was admitted to the general ward, but a much larger segment here than here at the age group 50 to 64 was admitted to ICU. See, this is ICU admissions, age 25 to 49. This bar graph here is ages 50 to 64. You can see a much less admission rate for ICU at this age group. Then if you go to the greater than 65, it's about 50-50. But that is not what's being reported by every single mainstream media outlet or any government. I actually watched a report today from a mainstream media outlet that says, on the good side, not that there is a good side, but if you were to say one, right now it seems to be infecting the elderly more than other segments of the population. And the deaths are mostly elderly or those with underlying health conditions. And that's just not true, people. That's not true. And even if it was true, why in the hell would that be okay? Now I'm 60, about to be 64. I know many of you watching and listening to the old man right now, you're within 10 years of that age, or my age or older. Is that okay? It's not okay with me. But apparently, to many on mainstream media, well, it could be worse. It's just affecting the elderly and those with, prior health conditions. That's not humanity, folks. So, what's going on here? There are a few potential explanations for the discrepancies between the early reports out of China and the information in these new Lancet studies. One is authorities in Wuhan were the first reporting on the outbreak didn't have enough information to piece together an accurate picture of the virus before releasing it to the world. Now, I want you to stop and think about that a minute. Now, this panel of doctors, what they did was they looked through the patient's records that were electronically transmitted to them, and they reviewed them. They put this information together in this here study that was published by the Lancet Journal of Medicine. Now, and several of them are Chinese. Why couldn't the Chinese government have done that? Well, I'm thinking they could have. And if you remember the story of AIDS, there were many initial hypotheses of its origin and the cause at the beginning, just as with other emerging infections, said David Hyman, a professor at the London School of Hygiene and Tropical Medicine who also worked on the SARS outbreak. It's like a puzzle to put all the information together to understand where it came from, but the important goal now is to stop it from continuing to spread. And, it's plausible that the Chinese government didn't look over the data that they had right there in front of them, that they were creating, and come up with an accurate representation before releasing it to the world. I guess that's possible. But come on, folks. How probable is that? I'll leave that to you. Now, Tom Friedman, the former director of Centers for Disease Control and Prevention, likened the potential misreporting to the fog of war early in the outbreak. Another related explanation is that China's rigid bureaucracy caused delays in getting out the information about what was happening on the ground. There are a lot of internal processes that need to go through the bureaucracy in China to get official statements from the central government, explained Alexandra Phelan, a member of the Center for Global Health Science and Security at Georgetown University, who has lived and worked in China over the past 2 decades. That rigidity means information may not come out very, very slowly. This complex system of report may also prevent lower-ranking officials from reporting information, especially politically sensitive information, she added. So data does not get funneled up to the central government because of the challenges of how the information sharing is treated, both legally and normatively or practically. The New York Times' Mac Fisher had a helpful report on how the rigidly hierarchical bureaucracy discourages local officials from raising bad news with central bosses who help they might need. God save us all. A third explanation is that China was purposely playing down the health emergency as it did during the SARS outbreak of 2003. Back then, China was heavily criticized for reacting slowly, withholding information about the outbreak for too long, and putting economic considerations ahead of public health. The virus eventually killed 774 people and affected more than 8,000. Understand, as of today, folks, we've already slid past the 8,000 infection mark. The fact that the Lancet report is different from the official early Chinese account does raise enormous concerns around the truthfulness of the information coming out of China, said Stephen Hoffman, director of the Global Strategy Lab and Global Health professor at New York University. If China did intentionally withhold information, that would not only be bad for public health, but also illegal under international law. It would be a violation of the international health regulations, a legally binding treaty that covers how 195 countries respond to outbreaks like this one. It was also notable, Hoffman added, that on January the 20th, Chinese President Xi Jinping made his first public statement on the outbreak, demanding that all parts of the Chinese government put people's lives and health first. It is necessary to release epidemic information in a timely manner and deepen international cooperation, he said. Within days, the number of cases doubled, and they've continued to rise rapidly since. As recently as January the 14th, there were only 41 confirmed cases of the new coronavirus. Now I want you to think about that. 5 days after Xi's announcement, more than 2,000 cases were confirmed. But think even about these numbers. Here on January the 30th, we're at, I think, 8,123 with 170 confirmed deaths. From that perspective, it looks like China is reporting now, Hoffman added, noting there's no evidence at this time that they're withholding information. But you always need to be worried when one source isn't as forthcoming from the beginning. You never know later on. And if this virus continues to move at a dizzying speed, the question of whether China mischaracterized what they knew about the virus will become even more urgent. It's crucial to understand the earliest days of an outbreak, said Georgetown's Lucy. Not only does it help us understand how deadly and transmissible a virus is, it gets at how there's been such a rapid spread of the virus, not just across Wuhan, but to every province in China except for Tibet. So there you have it, folks. However you want to believe it. Was China honest? Did they just miss it and misreport the information on when this coronavirus started and where it originated at? Or did they outright lie to the world? I'll leave that up to you. I have my own opinion. With all that said, since the Lancet Journal of Medicine published this study, ask yourself, is it plausible that the United States government and governments of other countries around the world were not aware of what this particular study published in the Lancet Journal of Medicine contained and revealed? Think about it. Another thing I want you to think about, it was on January the 24th the same day this study came out and was published, that the United States government decided to evacuate their people from Wuhan, China. The staff of the US Embassy and Consulate, and shut it down. Was it because they were aware of the study and its findings? Who's to say? We can't expect them to tell us that. But the most disturbing fact of all this is this study, as well as a second study that's been published on 99 more coronavirus patients confirmed out of Wuhan, China, that the information is available. It was published, made readily available to the world in the Lancet Journal of Medicine. Now, do you think for a second that if a little old retired engineer in Alabama can dig this stuff up, read it, analyze it, what do you think the chances are that the United States government, as well as other governments of developed nations, weren't also aware of this, let alone all of our mainstream media outlets? What's the possibility that that's even possible, that they miss this? I think that would be extremely slim, like infinitesimal, to say the least. And that being the case, what would be the motivation for not reporting it, not sharing it with the general public, and the continuing misreporting of not only the fact of where this virus originated from, which, as you can see by the Lancet study, couldn't possibly have been the Wuhan Seafood Market, since patient 0 had no prior contact with that market. Secondly, there is been proven by the study that there was human-to-human transmission of the novel coronavirus from the very onset of the viral outbreak. But here today, January the 30th, you can still go on television, you can still go on the internet, and still read and listen to them tell us that there is no confirmation at this time that proves there's human-to-human transmission. And they support this by the fact that such countries as the US, Canada, and France have had no further cases. But with everything I've just told you and showed you, and as always, I will provide links to these articles and websites in the video description below. With all that said, are they being truthful with us now? Are there only 5 cases of coronavirus in the U.S.? Really? Is that all we have? Or is our own government withholding information from us and not reporting on new cases? Something else I want you to consider about that statement right there is the 210 people that were aboard the evacuation flight from Wuhan, China, our embassy personnel and private U.S. citizens, while that flight was in the air, flying to the U.S. Our U.S. State Department decided not to allow that plane to land at the Ontario Regional Airport in California. They decided to divert that plane to the Marshall National Guard Air Force Base in California. Their reasoning was so they could take better advantage of the logistics capabilities of that Air Force Base. I don't know about you folks, but we all know that our National Guard bases are nowhere near as well funded or well stocked as our primary military bases. Secondly, I want you to understand that the Ontario Regional Airport had up to that time been expecting to receive that flight. They had no problems with it, as was shown on TV and many news reports and interviews, and they had prepared to receive those passengers. But yet again, our State Department determined that they needed to divert that flight to Marshall National Guard Air Force Base in California. Why? That begs the question. Then there is the question, why we're only going to quarantine them for 3 days when we all have heard that the incubation period can be as long as 14. Now granted, based on reports out today, they are going to be tested by the CDC to see if they have the virus. And that's a good thing. But what I also learned today was that was also voluntary. They didn't have to, they didn't want to. But it was thought that most of them would want to. Why wouldn't they? And I agree with that. I would want to. But this begs the point. Is China misled us or misrepresented the facts? I truly believe, as I think all of you will after listening to my proof here on this video, that there was no way the U.S. government or any other developed nation's government couldn't have been aware of these studies published in the Lancet Journal of Medicine, or any mainstream media outlet worth their stuff. But here again, we're having things reported to us that is not the fact or reality of the current situation of the novel coronavirus. And in a video that will be coming up, I'm going to attempt to answer the question why the U.S. government and other governments would want to downplay the reality of this novel coronavirus outbreak. I think if you think about it for a moment, you'll know why too. It's always about one thing, folks. So now I'm going to leave you with all this. I want you to think about it a while. Digest the information. I hope you will read the article that I'll be providing below the video in the description, as well as the studies that were published in the Lancet Journal of Medicine. I will say this about the studies. They also provide a lot of insight onto who was infected, what the demographics were, as far as age groups and that, medical conditions that these people had, the rate and percentage of those who were admitted to the hospital, how many of those actually had to be treated in ICU. And all of that will also contradict what's being fed to the public by the mainstream media. I do hope this video finds y'all well out there and healthy. I do hope you will take it for what it is. It's not to project fear or panic. It is my attempt to inform my friends and family, my loved ones, of what the reality of the situation is, so you can take the appropriate action and plan how you, should it become necessary, will prepare to prevent your infection to the novel coronavirus in 2020. And as always, I want y'all to take care out there, stay safe, and may God bless you and all of us. Till I see you on the next time, on the next video, prepare as you will to keep yourself safe and healthy. This is Mr. Tom. Goodbye for now.